most of the cases so far, the measles cases, have been in rural West Texas near the Texas-New Mexico border. But now cases are being linked to travel, which they say could pose a threat here in North Texas. Nicole Nielsen has the latest.
Dr. Philip Wong, the director of Dallas County Health and Human Services, knows how fast infection can spread.
I've spoken to the health department director out in Lubbock. They're continuing to identify new cases. She had estimated it's probably going to be at least 200 to 300 cases.
Texas reported its first measles case since 2023 last month, when 2 cases were reported in unvaccinated Harris County residents who returned from international travel. Quickly after, state officials were made aware of several cases in Gaines County. Now, the state is reporting 90 cases in 7 counties in West Texas. 16 people are in the hospital. Even more concerning, some of those patients have recently traveled in our state.
They found some of the people who have traveled to other areas that are now then, causing some risk.
Here are the most recent exposure sites in Texas. If you are at any of the following locations on the listed dates and times in San Marcos, San Antonio, Live Oak, or New Braunfels, you should be on the lookout for symptoms, as the virus can survive in the air for up to 2 hours.
There are pockets within, our own community where people not vaccinated.
According to the state health department, most current cases are among unvaccinated people or with an unknown vaccination status. Right now, Dr. Huang says their priority is to get any groups of unvaccinated people in Dallas up to date on their vaccines as quickly as possible if they're willing. He says if you've already had the 2 doses of the MMR vaccine, you're 97% protected. Dr. Huang says they're continuing to monitor cases by the day and says if cases are reported in North Texas, they'll be ready. In Dallas, Nicole Nielsen, CBS News, Texas.
So how do you know if you've been vaccinated for measles? Health officials say to review your medical records or check your immunization records with your doctor. If you were born in the U.S. before 1957, it's likely you did receive the vaccine as part of a routine childhood immunization schedule. If you travel to areas where measles is prevalent, you may want to be vaccinated or you may need to be vaccinated. Finally, a blood test performed by your doctor can confirm your immunity to measles.
For the vast majority of people, if you've gotten your measles shots, you should be protected. It should be something that works for life.
So who should get the vaccine? Children should receive 2 doses, the first at 12 to 15 months and the second dose at 4 to 6 years of age. Teens and adults should get 1 to 2 doses of the MMR vaccine if they don't have evidence of immunity. Those traveling internationally should get fully vaccinated. And if you plan to become pregnant, you should get the vaccine to reduce the risk of passing it to an unborn child. It's also important to note that although the vaccine is generally considered safe and recommended for most individuals, there are certain situations where it should be avoided. For instance, if you've got a history of severe allergic reactions to vaccinations, neomycin or gelatin. People with severe immune suppression due to HIV infection, chemotherapy, or high-dose steroids. Pregnant women should not get the vaccine as it can harm a developing fetus. And of course, if you're ever unsure, you should consult your doctor.